tape sticks,
Go.
as well as scissors to cut any of the tape that you
Don't
need.
start.
It's already started.
In the
We're doing this
pre-taping
one this way.
procedure,
Oh, look.
you're going to want to apply heel and lace pads at the high friction areas.
So I don't have heel and lace pads for this demonstration, but if I did have them, I would apply one. I would apply one at the high friction areas, one here and one here, to make sure that we give a little bit more protection to those areas of the ankle. But I don't have those, so I'm just gonna have to pretend like I have them on.
One at the distal aspect of the Achilles tendon and the other at the dorsal aspect of the ankle joint. Both of these are going to have skin lube on them to help hold them to the foot.
So again, we'd put one about here, and then one right here around the Achilles tendon area.
Apply some pre-wrap to secure the two heel and lace pads in place, as well as reduce the skin irritation. Now we will apply an adhesive tape anchor strip around the lower leg at approximately the musculotendon junction of the gastrocnemius. Since the leg at this side is not cylindrically shaped, the tape must be angled slightly. This slight angling allows the tape to conform smoothly to the shape of the leg. An additional anchor will be applied at the instep or midfoot. And remember, that excessive tension on the fifth metatarsal could cause pain on weight bearing.
Having some difficulty with the technology.
You remember what's next?
Application of the first set of stirrups is performed, beginning on the medial aspect of the upper anchor. This stirrup continues down the inside of the leg over the medial mount.
Got that.
Malleolus across the plantar aspect of the foot, over the lateral malleolus, and up the lateral aspect of the leg, and ends at the lateral aspect of the upper anchor. Proper tension must be applied to cause some eversion of the foot, thus helping to reduce inversion. And you want to apply at least 3 strips.
Okay.
Following the application of the stirrups, you can apply some cylindrical anchor tape to make sure that the stirrups stay in place and are secure. the placement of the cylindrical anchor tape, you are going to apply what we call horseshoe strips. And these will be placed first on the first horizontal strip is started on the medial aspect of the foot and continues toward the heel and below the medial malleolus, crosses the Achilles tendon below the lateral malleolus, and ends on the lateral aspect of the foot. If using the midfoot anchor, begin and end this strip on that anchor.
Stop.
The first heel lock strip is applied. Begin on the
Okay, you can start it.
anterior portion of the upper anchor. This lateral heel lock will continue down the outside of the leg, crossing the Achilles tendon around the lateral aspect of the heel, angling underneath the foot, moving up the medial aspect of the leg, and ending at the anterior portion of the upper anchor. Proper tension must be applied to ensure stabilization of the calcaneus. The second heel lock strip is applied. Begin on the anterior portion of the upper anchor. This lateral heel lock will continue down the inside of the leg, crossing the Achilles tendon around the medial aspect of the heel, angling underneath the foot, moving up the medial aspect of the leg, and ending at the anterior portion of the upper anchor. Again, proper tension must be applied to ensure stabilization of the calcaneus. Repeat number 6 and 7 for additional support. A figure 8 is applied next. Starting on the dorsal aspect of the foot, move medially down the inside of the foot, across the plantar portion, up the outside of the foot to the starting point. Continuation of the tape will proceed medially around the lower leg, crossing the Achilles tendon, and finishing at the origin of this figure 8 technique. By encircling the foot and lower leg, this technique will assist in dorsal flexion and eversion. Finally, closure strips are applied. Begin proximally and work distally from the upper anchor. Apply an individual circular strips around the extremity to cover the tape ends. Make sure you overlap the tape approximately 1/2 its width on each strip.
How's it feel?
Good.
Ankle tape.